Dr. Fauci is also risking lives every day with misinformation on the mask. So if you're 80 years old and your spouse has COVID and you're staying with them, and this is what happens across America, you're staying with your spouse to take care of them, you're intimately with them, you're helping them get food and clothing, you're taking care of your spouse. If you wear a cloth mask, you're putting yourself at risk because there's no value in a cloth mask. So by telling people that all masks are the same and that they all work, he's really putting people at home. He should be telling people, number one, if you're dealing with someone at home, wear an N95 mask. But number two, he should also be telling people that there is a treatment. The IV monoclonal antibodies can save your life. They're now approved even for a spouse that's not yet sick or positive. They take it and it's an 85% reduction in hospitalization or death. But instead, Dr. Fauci utilizes all of his 20 interviews a day to talk about putting masks on that don't work, bad information, misinformation. And I've yet to see an interview where he's telling people there's a window of time, and if you miss it, you can't get the treatment. Monoclonal antibodies, they don't give them the first day, but they also don't give them the last day before you're on the ventilator. There's a window of time as you're getting sicker, you're eligible. But if you miss that window of time and you get admitted to the hospital, they won't give you the monoclonal antibodies.
Florida's doing a lot with that now, I know.
So the White House is very focused on you and on your state, and this is the centerpiece of their domestic agenda, vaccine mandates. This is the whole thing. It's what they care about most. So if you openly defy them, I mean, are you expecting them to hit back, try to choke off federal health care money to the state, or do you expect some kind of confrontation with the Biden administration?
Well, I'm sure they're going to do whatever they can. Tucker, over the summer when we had Delta hit, I started a monoclonal antibody program because people were being admitted to the hospital without getting early treatment. So since we put that program in, our daily admissions have gone down about 90%. Well, as we were doing that, Biden tried to cut off the supply to Florida because this was working. And so I imagine they're definitely going to do something to try to hit back. But at the end of the day, do you want to protect people's jobs or do you not? And I'm going to be on the side of protecting people's jobs. And if Joe Biden wants to be on the side of causing people to lose their job, well, then we'll let him do that and we'll fight the good fight.
Yeah, because he knows more about medicine than nurses and doctors. It's like lunacy.